Hi everyone, today we're starting a very important joint, temporomandibular joint. We've already recorded and uploaded its video, but very sadly it doesn't have a voice to it, so I have to record it all over again. Anyway, so temporomandibular joint is a joint of synovial variety, and it's basically an articulation between the mandible and the temporal bone. So temporomandibular joint, the temporal bone and the mandible, right? But exactly what portions of these bones? So this is the coronoid process of mandible because this is bird and it has a beak, right? So it's a crow. So coronoid process. So beak is always pointing interiorly. So interior, this is the coronoid process, and posteriorly you have the condylar process. So this articulation is between the condylar process and the temporal bone. And which region of the temporal bone? The articular tubercle and the mandibular fossa. So what exactly is the articular tubercle? It's right here, and then there'll be a fossa here. So this is the articular tubercle, and this is the mandibular fossa. You may not be able to see it clearly right now, but I'll show you a temporal bone picture. So for now, just know the temporomandibular joint is basically a synovial articulation between the articular tubercle and the mandibular fossa of the temporal bone above and the head, or you can say condyloid process of the mandible below. And yeah, so let me just go to the temporal bone now and let's get that done with. So here you can see this is the condyloid process, this is the coronoid process. Right, so moving forward, this is the temporal bone right here. You can see this is the temporal bone. This is the temporal bone at the temple region. This is the mastoid process. That's the styloid process. This is the tympanic plate of the temporal bone, or tympanic part of the temporal bone, right? So this is the tympanic plate. Also the external acoustic meatus. This is the mastoid process, styloid process, right? So this is petromastoid part, this is the squamous part, and this is the zygomatic process of the temporal bone, right? So zygomatic process of the temporal bone. And right here, this is the fossa, the mandibular fossa, and this is the articular tubercle, right? So mandibular fossa and articular tubercle. I hope that's clear now. And also here we will have a look. This is the temporal bone, exactly the same. Styloid process, tympanic plate, zygomatic process, squamous part, and petromastoid. I hope that's clear. And here also you can see how it covers external acoustic meatus and the tympanic plate as well. And this is the mastoid process behind your ear. You'll be able to touch it if you touch deep enough. And in front, this is the zygomatic process of the temporal bone, right? And this is the mandibular fossa, and this is the articular surface, articular tubercle. So articular tubercle and the mandibular fossa. So right here again, articular tubercle, mandibular fossa, and then this is the mandibular head or the condylar head, right? And this is what? This is the articular disc which resides between uh, the two articulating surfaces. So articular disc does what? It divides this entire synovial cavity between the joint into two parts, and in a superior and an inferior, right? So basically it divides it into a superior and inferior part, an upper and lower part, and yeah, it has its own significance, right? That also I'll let you know. So for now, you know the temporal bone also really well, I hope. Now moving again backwards, there's another thing, do not be confused between mandibular fossa and mandibular foramen. So this is okay, this is again the articular disc, and then you can see upper and lower part, right? And this is the articular process, and then this is the mandibular fossa. Right, so we're talking about mandibular fossa and foramen. So mandibular foramen and fossa, these are two different things. Where's the diagram? It's not here, but I've uploaded a video. I don't know where the diagram is gone, but I've uploaded a video. You can refer to that. So this is attachments, right? So there is one diagram where you'll be able to see the mandibular foramen. So this is the mandibular foramen towards the inner aspect. So the inner aspect of the mandible, and there this is the mandibular foramen, and right there you'll have the lingula, right? To the lingula is attached the sphenomandibular ligament from the sphenoid bone to the lingula, right, of the mandible. And also in this mandibular foramen, what runs? The inferior alveolar artery and nerve. We'll talk about this also. Fine. So I hope that's clear with you by now. This is mandibular foramen in the mandible, and in the temporal bone, you'll have the mandibular fossa. Right. Now moving forward, let's refer to the book, and then I'll tell you everything. Okay, and let me just tell you about the ligaments and then we'll move. So this is a very important joint capsule. There's a fibrous capsule that surrounds the joint and is attached above to the articular tubercle. and the margins of the mandibular fossa, and below it's attached to the neck of the mandible, the same articular surfaces, right? So this is joint capsules. This is the first ligament or fibrous capsule. Then the second you can name as lateral temporomandibular right here. Lateral temporomandibular is here. Then you have the sphenomandibular ligament. Sphenomandibular ligament from the sphenoid bone to the lingula of the mandibular foramen. Then you'll have the stylomandibular ligament. Stylomandibular ligament, and then there's one more ligament which is not visible here. So there are three mentioned in Snell's, four actually, including the joint capsule, but there are five mentioned in the BD book. So the fifth is this one right here, which is known as this one right here, which is known as pterygomandibular ligament. Pterygomandibular ligament over here, you can see it's somewhere inside. So yes, it's inside. If a person opens their mouth, right behind the molars, you'll be able to see this pterygomandibular. So this is pterygomandibular ligament. This is pterygomandibular, a pterygotemporal depression. But anyways, that's not something for you. So this is pterygomandibular ligament. So it attaches or it runs from the pterygoid plate to the mandible, right? So pterygomandibular ligament. So that's the pterygomandibular ligament. Right here also you can see pterygomandibular raphe or pterygomandibular ligament. It's a tendon. Pterygomandibular raphe, also called pterygomandibular ligament, is a tendinous band of buccopharyngeal fascia. Buccopharyngeal fascia, so one of the deep cervical fascias, extends from hamulus of the medial pterygoid plate of the sphenoid to the mylohyoid line of the mandible. The buccinator muscle attaches to the anterior margin of the pterygomandibular raphe, while the superior constrictor muscles attach to the posterior margin. Its medial surface is covered by oral mucosa because it opens inside, and the adipose tissue separates its lateral surface from the ramus of the mandible. So this is pterygomandibular ligament. So there are five ligaments. I hope that's clear with you. Fibrous capsule, which is joint capsule, then lateral temporomandibular ligament, then sphenomandibular ligament, then stylomandibular ligament, and the fifth is the pterygomandibular ligament, right? So these are the ligaments. Then we have to talk about the nerve supply. Nerve supply is very important. It is supplied by the auriculotemporal nerve and mesenteric branches of the mandibular nerve and the mesenteric branches of the mandibular nerve. Here, mandibular nerve. So mesenteric branches of the mandibular nerve as well as the auriculotemporal nerve. This is a very important nerve. This is involved in the freeze syndrome where there is excessive sweating. Remember? So auriculotemporal and mandibular nerve. These are the nerves. When you talk about the nerve supply, the artery blood supply, so it has very important maxillary artery as well as superficial temporal artery. This is the maxillary artery, and then you'll see there will be a superficial temporal artery. Now, there's a drawing for that as well that I'll show you. Now, let's read the book. We've covered major chunk of the temporomandibular joint, and then whatever is left, we'll go along the book and cover that as well. Yeah, so this is the, let's just first talk about the blood supply. You can see this is external carotid artery, then it forms posterior auricular artery. It goes forward, it gives a branch maxillary artery and a superficial temporal artery and transverse facial. So what is the blood supply for this? Maxillary artery and superficial temporal artery. It's better you learn this because this is a very frequent, arteries that appear on and off. So you can see superficial temporal, it's also mentioned here. And then here you'll see this is maxillary artery, right? And yeah, so that's how you can recall it. And also here you can see superficial temporal, and then this is the maxillary. Now moving forward, actually backwards. So synovial joint of condylar variety. An upper articular surface is formed by the following: articular tubercle, anterior part of the mandibular fossa, and posterior non-articular part formed by the tympanic plate, but that's non-articular part, so we are not going to discuss that. The inferior articular surface is formed by the head of the mandible, the condylar head. The articular surface are covered with fibrocartilage. The joint cavity is divided into upper and lower parts by an intra-articular disc. The ligaments are fibrous capsule. Fibrous capsule is there. And what's the role of fibrous capsule? It basically ensures that everything is intact and it stays in place, and especially this capsule helps bind the articular disc to the mandible head. So whenever mandible head, the entire mandible is moving forward or backward, protrusion or retraction, so it takes the entire, um, what do you call it, the fibrous capsule is also taken with it together, right? So that's the function. Now, moving forward, we have lateral temporomandibular ligament. This reinforces the strength and strengthens the lateral part of the capsular ligament. And other than that, it limits the movement of the mandible in a posterior direction and protects the external auditory meatus. This has a very important function that it strengthens the lateral aspect of the capsule. So the lateral aspect of the capsule, if you can see right here, lateral aspect of the capsule, it is strengthened. But other than that, this also ensures that there is not excessive posterior direction movement. And if there's excessive posterior direction movement, it can damage this tympanic plate. So we do not want that, right? And then moving forward, you can also see this subdivision attachments of the articular disc of the temporomandibular joint. This is the you can see how this is the articular disc in the middle, and yeah, intra-articular disc, right? Now moving forward, there's another ligament which is sphenomandibular ligament, and this attaches from the spine of the sphenoid to the lingula of the mandibular foramen. This is the remnant of the Meckel's cartilage. It's a very important MCQ point question. And near its lower end, it's pierced by the mylohyoid nerve and vessel. So it's pierced by the mylohyoid nerve and vessel. So why do you think would that be the case? So right here, right, and here exactly we'll have the mylohyoid groove, and in the mylohyoid groove pass the mylohyoid nerve and vessels. So here you can see mylohyoid groove will have the mylohyoid artery and the nerve. Okay, then moving forward, so we're done with sphenomandibular ligament. Then we have stylomandibular ligament. So stylomandibular ligament, if you can recall, we already studied. This is a thickened part of the investigator of deep cervical fascia, which separates the parotid and submandibular salivary glands, and it is attached to the styloid process and below to the angle of the ramus of the mandible. So it attaches from the styloid process to the angle of the um, mandible. So stylomandibular ligament. And then, yeah, so these are the five ligaments, and I hope now you understood the function. So first of all, fibrous capsule, it is there to strengthen the lateral aspect of, it is just there in order to bind everything together. Lateral mandibular, temporomandibular ligament, it strengthens the lateral aspect of the capsule, and also it ensures that there is an excessive posterior movement so that the tympanic plate isn't damaged. It's a very important point. Then you have sphenomandibular ligament, just know its attachments and that it's called Meckel's cartilage. Then you'll have the stylomandibular ligament. It is formed by investing layer of the cervical fascia and it separates parotid and submandibular gland. And then you have pterygomandibular ligament from pterygoid hamulus to the mandible. So pterygomandibular ligament from the pterygoid hamulus of the sphenoid bone. You may be wondering what's the pterygoid hamulus. Let me just show you sphenoid bone as well. This is the sphenoid bone, right? So it has a lesser wing, it has a greater wing. This is the greater wing, this is the lesser wing. That's the body. It has a pterygoid canal here. Now here it has a medial pterygoid plate. Towards the end of the medial pterygoid plate, you will have the medial, you will have pterygoid hamulus. So medial pterygoid plate, pterygoid hamulus. And here this is lateral pterygoid plate. So medial pterygoid plate, lateral, medial, lateral, and hamulus is in the medial pterygoid plate. Easy. Now, articular disc, it divides the joint into an upper and lower compartments. Upper compartment permits gliding movement, whereas the lower compartment permits the gliding as well as the rotatory movement, because the lower part of the jaw or the mandible itself should be able to rotate as well, like forward, side to side, and everything. So upper is fixed most of the time. So upper compartment allows gliding and lower allows gliding and rotatory. It prevents friction between articulating surface, it acts as a cushion and helps in shock absorption. It stabilizes the condyle by filling up the space between the articulating surfaces. Proprioceptive fibers present in this help to regulate movement of the joint. So it also has proprioceptive fibers that will help to regulate the movement of the joint. Then moving forward, this disc helps in distribution of weight across the TMJ by increasing the area of contact. Now, when you talk about the relations, so yeah, the relations, it's important. Also, the disc is in okay, I have to tell you something about the articular disc. It intervenes upper and lower compartments. The disc is an oval plate that attaches circumferentially to the capsule. It is also attached in front to the tendon of the lateral pterygoid muscle and by fibrous bands to the head of the mandible. These bands ensure that the disc moves forward and backward with the head of the mandible during protraction. So basically, this is bound by the fibrous bands to the head of the mandible and to the tendon of the lateral pterygoid muscle. You may be wondering what is the function of lateral pterygoid muscle here. So basically, head of the mandible, right, especially condylar part, that has lateral pterygoid. So by fibrous bands, your articular disc is bounded to the lateral pterygoid as well as the head, the condylar head. So this ensures that the disc also moves along forward and backward with the head of the mandible during protraction and retraction. Synovial membrane is going to line the capsule in both upper and lower cavities of the joint. That's something you know. Um, Moving forward, relations. So for relations, you do not need to know them, but I'll just tell you briefly that anteriorly you'll have the mandibular notch and mesenteric nerve and artery. So if this is the TMJ joint, right? So anteriorly, as such, anteriorly, right? This is the anterior and this is the posterior. So anteriorly, you'll have the mandibular notch. This is the mandibular notch, and there'll be mesenteric nerve and artery. So if you can recall, we already studied these are the mesenteric nerve and arteries, okay, vessels. And then after that, posteriorly, you must have already guessed there is the tympanic plate of the external auditory meatus and the glenoid process of the parotid gland. Actually, parotid gland, it's also there right here. So it covers the angle also, the back portion also. So there is the you can say glenoid process of the parotid gland, right? But for now, just note tympanic plate posteriorly and anteriorly mandibular notch and the mesenteric nerve and artery. Laterally is here the parotid gland. Again, parotid gland also covers laterally, right? So laterally, and it also goes posteriorly. Parotid gland, fascia, and there'll be skin. And medially, what do you think there'll be? There'll be maxillary artery and vein and auriculotemporal nerve. Now you may be wondering, how's that true? So see, if you look at this is the maxillary artery, this is the auriculotemporal nerve, right? And right here you can see this is the joint. So you can clearly see maxillary artery and auriculotemporal nerve. Now, I'll also recall from here in the medial aspect, if you see, so laterally here, if this is the TMJ joint, so medially, if you see the medial aspect, this is the external carotid artery, then you will have the maxillary artery and superficial temporal artery. So maxillary artery is going, and there is also auriculotemporal artery. So this is basically coming in the TMJ joint, right? So that's the relations. And yeah, so you already know the blood supply, which is superficial temporal and maxillary artery, and nerve supplies auriculotemporal nerve and the mandibular nerves, which branch? Mesenteric. So mesenteric nerve of the mandibular nerve. So mesenteric branch of the mandibular nerve. That's how you say it. Mesenteric branches of the mandibular nerve. Then movements are depression, elevation, retraction, protraction, and lateral side-to-side movements. Right. So depression, if you look at this diagram, you'll notice that depression for this, you have to look at this diagram. So depression is caused by just lateral pterygoid. So depression is done by just lateral pterygoid. So that's mandible depression. If we talk about mandible elevation, so it's caused by masseter, also temporalis, and also medial pterygoid. So medial pterygoid, temporalis. So these are the four muscles of mastication that you need to know. Lateral, medial pterygoid, temporalis, and masseter. So all the remaining they cause elevation and lateral pterygoid causes depression, right? Easy. Now, when you talk about mandible protrusion, so protrusion is caused by majorly lateral pterygoid. So lateral pterygoid causes protrusion, right? So everything that makes you look bad is done by lateral pterygoid. The protrusion is done by lateral pterygoid, and also the depression, like if you open your mouth, that's also done by lateral pterygoid, right? And also, slight bit protrusion is also done by medial pterygoid. Then when you talk about retraction, so retraction is done by majorly temporalis. So yeah, that's it. Temporalis does the retraction and masseter does the elevation. But temporalis can also do elevation and medial pterygoid can also do elevation. Protraction is done by lateral pterygoid. Depression is also done by lateral pterygoid. Mild bit protraction is done by medial pterygoid. Right? And chewing movements is important for you to know that, for example, if you're chewing from the right side, so it will involve the right masseter and temporalis muscle, and but the pterygoids will be of the opposite side. So that's the reason if there's so many chewing muscles involved, there's so many muscles involved for chewing. Therefore, chewing is a tiring procedure. Now, dislocation of mandible. Let's look at the clinical anatomy. Excessive opening of the mouth, the head of the mandible of one So head of the mandible, the condylar process of one or both sides may slip anteriorly into the infratemporal fossa. So it can slip anteriorly into the infratemporal fossa, as a result in which there will be inability to close the mouth. Reduction is done by depressing the jaw with the thumbs placed on the last molar teeth, at the same time elevating the chin. So how are you going to help this? So they're saying whenever a person excessively opens the mouth, so the head of mandible, it can slip anteriorly into the infratemporal fossa, and this will result in inability to to close the mouth. How are you going to solve this problem? By depressing the jaw with the thumbs placed in the last molar teeth. So you have to place the thumb in the last molar of the teeth, then you have to try to elevate the chin but depress the jaw. So I hope that makes sense. The arrangement of the articular disc may result from an injury like overclosure or malocclusion. This gives rise to clicking and pain during movements of the jaw, especially during eating. There will be clicking sounds. In operations on the temporomandibular joint, the facial nerve and the auriculotemporal nerve branch of the mandibular division of the this is the trigeminal nerve. So mandibular division of trigeminal nerve should be preserved with care.